What if I told you that fibroids are not just caused by hormones, but that there is a direct relationship to heart health? Stay tuned to learn how food, inflammation, and your body type all affect your fertility. What this doctor discusses in this video will change how you think about your diet and what steps you can take to improve your fertility.
All right, welcome here, Dr. Salcedo. I'm so happy that you agreed to meet with me and come on and speak to what you're passionate about. And so I'm going to ask you to introduce yourself and tell people what's your mission, why do you do what you do?
Yeah, well, thank you, Casey, for inviting me. I am Dr. Andrea Salcedo. I'm a board certified OBGYN in Southern California. I have a couple of hats. I am like a regular, boring academic OBGYN. I do a lot of traditional stuff, and then I also have a really nice integrative gynecology practice online where I help women really tease out lifestyle and how they can use different therapeutic nutritional modalities to help a lot of their gynecologic problems, and then I'm a mom. I have 3 boys. I have a husband, a really, busy family life and kids and sports and that kind of stuff. So, I totally get the demands of women, and I'm also approaching the perimenopause, which is like not fun. And so that's kind of interesting too. So I feel like I have a lot to share and perspectives to help women. I'm also a clinical researcher. I've published academic literature. I have something coming out in Menopause Journal in a couple months, so I'm not just a talking head. I actually do clinical research just to make sure that it keeps me very focused on evidence and not just the ideas, to help women, but actual physiologic evidence that helps bring about great results in gynecology. So here we are.
Wonderful. And, it's so important to have that evidence-based research, especially into women's health. I feel it's something that has been lacking. We don't have as much robust research as I'd love to see. So I'm happy that you're helping to fill that gap.
Yeah, thank you. It's a big passion of mine. I've always been kind of a research person. I really enjoy clinical research. And I actually, in training, thought I was going to be a high-risk OB doctor and helping women with high-risk pregnancies, specifically with ultrasounds and things, but ended up that I became a general OBGYN. And actually, because I actually really liked obstetrics and I didn't really like gynecology for a while, mostly because I felt like women were so frustrated with typical gynecologic care, because as you probably know, most problems in gynecology are treated with birth control pills or hormones and stuff. And not to say that that's not a good choice for a lot of women, because sometimes you really just have to treat women with medical therapy because they're bleeding out or whatever, and so, but I just felt like my patients like myself had questions about well, why do I need to do this? And how long do I need to do this? And why should I be on birth control if I'm trying to have a baby? And, those kinds of questions. So I actually didn't really want to do a lot of gynecology. And it wasn't until I had some of these problems myself where I was like, oh, now I'm really understanding what my patients are feeling when they feel stuck and frustrated with typical gynecologic care. So I really started doing a deep dive into the literature, trying to understand what endometriosis really is, fibroids really are. And really the result of all that was how we tend to silo gynecologic care as women's health issue, like hormone problems, and so I'm sure a lot of us have had the experience where they see their male doctor or even female primary care doctor and they're like, oh yeah, go see your gynecologist. I don't want to talk about that. That's hormones, and it's really not. A lot of these gynecology problems are actually mediated by a lot of cardiovascular disease and diabetes risk factors that just tend to express physically as bleeding or fibroids or pelvic pain. But it's all kind of the same thing, and so once I realized this, and that the uterus is an end organ, which is like an organ that receives inflammation from cardiovascular disease risk factors, just like the heart, just like the lungs, the kidneys and stuff. All those dialysis patients, all those heart failure patients are all people who've manifested over years of inflammation, pre-diabetes, diabetes dispositions, but the uterus is the same thing. It receives inflammation just like any other organ. And so once we kind of see that, then it's like a mind shift change. And then it feels like this stuff can actually be treatable with a lot of lifestyle factors. And so then it just became like my favorite thing. And so now it's like a huge part of my practice. I would never have thought I was going to do this, 20 years ago. I really didn't. I thought I was going to be all pregnant women. And that's a big part of my practice. I still do take care of a lot of high risk patients and stuff. But I really thought I was going to be something else. And I'm just so happy how like life brings, you to this place. And then I get to meet cool people like you, so this is awesome. So thank you for the opportunity.
Well, I mean, your work is what really inspired me to change my whole lifestyle. Like I watched a couple of your YouTube videos, and the video that really stood out to me and made me rethink everything is the connection between the fibroids and cardiovascular health. And so I really wanted to dig deeper into that and to, explore how the same risk factors are affecting women's fertility and women's health and hormones.
That's right. I love this. And so when we think about uterine fibroids, which are basically benign tumors of smooth muscle in the uterus, okay, so 99.9% of the time they are not cancerous, okay, so they're really just these benign growths of inflammation. Well, most of the time we're taught in training and in medical school and things that fibroids are genetically inherited. And that's sort of true. You kind of have to have like the gene disposition to have fibroids and stuff. And so that's sort of true. But in terms of risk factors, things that increase your risk for getting them are things that activate the genes that are able to turn them on. And so that's smoking, that's obesity, that's being slender on top, but more wide in the middle. And that's kind of like me, and so a pre-diabetic disposition, hypertension. And the reason is because the uterus is just one big smooth muscle. And so when we're in medical school, we learn about the different types of muscles. So, there's something called skeletal muscle, and then there's something called smooth muscle. And so skeletal muscle is kind of like the muscle that you would think of like in your biceps and things and all the big muscles. And then smooth muscle is the muscle that goes on all of your vasculature. Okay, so your arteries, all your blood vessels. Well, the uterus is actually just one big smooth muscle. And so that being said, when it receives inflammation from all of those risk factors that we talked about, then it starts to undergo inflammation and calcification changes within it that turns into these balls of fibroids, a leiomyoma, we call them. And this isn't like a new phenomenon. Like we've actually known this for like 50, 60 years. Like in the 1960s, there was these two pathologists in Chicago, I believe, called Dr. Moss and Dr. Bendit, who wrote the first couple of papers that actually looked at how uterine fibroid tissue, those precursors are the same precursors that create atherosclerotic disease, which is hardening of the arteries of like our body. So we've heard of like atherosclerosis and hardening of the arteries when you get older and stuff. And it's a major risk factor for stroke and heart attack and stuff. Well, it's the same ones that inflammatory response is the same response. And those progenitor myocytes, which is a fancy word for smooth muscle cells that can kind of turn into different things, are the same ones that cause uterine fibroids. And so once I heard that, I was like, oh my gosh, like there is so much here to like help women to learn about where all this came from. And it's also like fibroids are one of those things that a lot of folks know about. It's pretty common. And so because a lot of us have these preconceived risk factors that come from our environment and stuff. And so 70% of Caucasian women will have uterine fibroids and 80% of African-American women will get uterine fibroids. Actually more in the United States than there is like in Africa in general, which is very interesting too. And that has a lot to do with like really like the concept of weathering, which is like the concept of microaggressions and like hyperimmune response that activates more inflammation that leads to more cardiovascular disease problems in the African American experience in the United States was very interesting to me. And so that is another interesting risk factor. And so those things collectively like bring about fibroids in modern culture. But for a long time, we didn't see a lot of this stuff until more modern diets and experiences and the move away from old cultural practices that we used to do when we were, like in traditional societies and collective societies and stuff. And so those are the kinds of things that kind of bring fibroids out for certain people. Now, there are certain folks that are more predisposed to fibroids than others. And so what we're seeing in a big part of my own clinical research is like looking at body type and habitus and trying to figure out like who is more likely to be predisposed to get this based on like your body type. And so there is this idea and that kind of is circulating in the metabolic health community and a lot of doctor communities and health communities about like what we call the obesogenic body type. So these are the people who are like, you can barely like look at a piece of cake and like you get chubby like all over, right? And then there's other folks who are more like the energy, like thrifty, what they call it, diobesogenic phenotype, where they tend to kind of carry their weight in their midsection and they're more thin on top and then they're more like apple shaped on the bottom. And these are the people who can like pretty much eat like a lot of foods and they don't look chubby, okay? And they don't get that extra weight gain, but they get that inflammatory adipose tissue in their center. And so I'm kind of like that person. And so,
me too.
And people are like, it's not fair. You can eat all this junk. And like when I was in high school, I used to eat a bunch of junk and like I was not really big. And those are the people that actually get more diabetes, more atherosclerotic disease, more heart attack, stroke. So all the end organs, okay? And those are also the people who tend to get more uterine fibroids, what I'm noticing clinically, which is very interesting. And so the other folks, the ones who are obesogenic, who are more peripherally weight stores, those are the ones that tend to get something called endometrial polyps and also uterine cancer later. Okay, but they usually have smaller uteri and they don't really get uterine fibroids typically. And so these are all like kind of newer concepts. Like it's all kind of data free zone. Okay, these are just like clinical tendencies, that we're noticing. And hopefully we'll publish a couple of papers on that soon to really bring home the point. We do know that there are risk factors for fibroids, and these are the people who have central adiposity and stuff. And so this is exciting, and it's going to help us teach women how their body may present gynecologic disease. And so to bring it back, Casey, to what you're talking about with like fertility and blood vessels, right? So these are also the people that tend to have a little bit more problems with fertility because it's not just the uterus, it's the blood vessels that are leading to the ovaries. And if the blood vessels that are leading to the ovaries are inflamed, then that means that they're not working as well. It means that they're not bringing as much oxygen and nutrients to the ovaries to bring about a robust ovulation. Okay. And so a lot of times these women tend to have lower AMH levels or anti-Mullerian hormone levels because they have a lot of inflamed blood vessels leading to the ovaries. And so these are the younger women who are surprised that they have low AMH levels. It's really devastating to hear that, And so, but a lot of times we can really treat that with low carbohydrate diets, low inflammatory diets, and that can help women sometimes, in the long run. So it's really exciting stuff.
Amongst my peer group, myself included, I have 5 very close girlfriends who have gone through fibroids and one had to do a hysterectomy because the fibroids were so big that, they just could not save the uterus. And so is there anything that someone can do to reverse fibroids or to prevent fibroids? You mentioned diet a bit and some other environmental factors, but what could someone do to prevent, this development of fibroids?
Yeah, this is a really great question. And so because this is a newer emerging field, there's not a lot of data that supports like some of the interventions I'm going to talk about, but there is good information that supports the theory of the physiology behind this. Okay. And so there's 2 concepts that we have to talk about. So the first is high insulin levels. Okay. And then the second is inflammation. All right. So high insulin levels from lots of different things. Now, insulin is a stress hormone. And we actually think of insulin as like a diabetes thing and stuff. And people who have really bad diabetes, they get injections of insulin and stuff. And so what happens is your pancreas is an organ that secretes this hormone insulin that helps sequester glucose from foods that you eat into like the circulating fatty tissue, but also into like the muscles of your body and all of the rest of the cells, but by and large, those areas. Also, the thing that can raise insulin is also stress. Okay. So when your body is under any kind of stressor, now here's the part that's hard to swallow. Okay. So when we were cavemen, okay, and even now, women were biologically created to have babies, right? Like that's like what we were created for. Now, that being said, if our body is under any kind of stressor, our old brain, our reptilian brain, is going to be constantly monitoring and making sure that we're in a healthy enough environment to have a baby. Because as you know, having a baby is easily like a 3-year commitment. It's like 1 year of being pregnant, and then 2 years of active, really hardcore child rearing. Okay, where like the biologic investment and resources is really high. And so because of that, if you're not having a really good diet of just mostly carbohydrates, which really don't have any nutritional value, or if you're under any kind of stressor, that high insulin level is going to raise, and through a series of feedback mechanisms, sends a message to your hypothalamus to stop ovulating. Okay. Because you're under a stress, it's not a good time to have a baby. And so whether our rational brain agrees with this, right? That we're like, no, I'm not stressed out. I'm doing 10 things, but I could totally have a baby. Like whether our rational brain agrees with that or not is like off the table, because our reptilian brain, our hypothalamus, is constantly sensing and what's going on. So that's the first piece. With high insulin levels on its own causes a lot of body inflammation, as well as any inflammatory trigger that our body is receiving. And high inflammation damages blood vessels. Okay. So insulin causes high inflammation, but any other trigger that causes high inflammation will damage blood vessels. And these are like every blood vessel, the blood vessels that go to your heart, your lungs, your kidneys, but your uterus, and the blood vessels in the lining of the uterus. Okay. So like some people are like, oh, I have all these heavy periods, but like I did an ultrasound, there was no fibroids, or like the doctor says I'm normal. Well, the ultrasound doesn't look at microscopic blood vessels at the lining of the uterus. And so when the lining actually sheds that first day, it's usually the second day that's like crazy heavy, because now the uterus has this raw bed of blood vessels that should constrict and stop bleeding. But if it doesn't constrict because it's under inflammation, then it takes longer to shut down that bleeding edge. And then people have these long, prolonged periods, right? And so really the crazy thing is a woman should only be bleeding the equivalent of 2 shot glasses a month. That never even happens anymore, but that's how it used to be. And so now there's like period pampers, and like all this stuff, because we're just tolerating these heavy periods, right? And it actually was not like this, like even 25 years ago. And so that being said, high insulin levels, high inflammation is what tends to cause the majority of gynecologic disease, because it's a blood vessel issue, really. Okay. And so if you can kind of control your insulin levels and control your inflammation triggers, then you can really get somewhere. Now, there's no data to support that a low carb, high fat diet or removal of like an autoimmune diet or whatever will shrink a fibroid. There's nothing that says that. However, there is really great data to support how ketogenic diets and things like that are shrinking brain tumors like glioblastoma. That's amazing. And like all kinds of really cool case series and reports that are coming out to help move the needle about how we can use this to treat like tumor growth. There's a lot of data to support how low carb, high fat diets can treat diabetes and that kind of stuff. But there's newer data to support how its use in tumor growth. And I have nothing that says it'll shrink a fibroid. If anybody wants to send me their information as a case report, I'll definitely help publish it. But because this is so new, there just isn't anything out there. But I would argue that if a woman was able to reduce those inflammatory factors and had small, like less than 3-4 centimeter size fibroids, I don't see a reason why your body couldn't heal itself, now that's a huge leap of faith, but I just feel like it just makes sense. Like now that's the reason why that we have modern medical technology, right? Because like some people have giant fibroids and no amount of low carb, high fat dieting is like ever going to make those go away. And so that's why we're trained surgically, so I take out big fibroids for people and stuff. And I say, okay, we're going to take this out, but let's try to reduce those inflammatory triggers. So no, like there's not new ones that grow, and that's okay. So, that's why like, I think a good gynecologist needs to have all these methods in their toolbox so that we can help women, not just say only lifestyle, because sometimes that doesn't apply. So.
And, I had a friend, the same friend who had to have that hysterectomy. She tried all the diets, and I tried too before I had to do my myomectomy, tried low fat, well, not even low fat yet. I tried the plant diet, all the plants, and nothing helped. My surgeon told me that when I had my myomectomy that I'd have the baby quick because they're going to grow back. Because, I still had the uterus, still had the ovaries, still had, the hormones going, even though my AMH was super low, she was still saying, expect that the fibroids will come back. And I did get one ultrasound that showed a little growth, but then that has gone away since I switched to a low carb diet. So maybe it's not going to work for too far advanced fibroids, but maybe there is some hope for persons who are just have small fibroids or just on their journey as they're getting old and they're going through more, environmental stressors. That's
right.
A possibility.
That's absolutely right.
And the same friend, she tried supplementation, and I think I heard Dr. Elizabeth Bright, she speaks about iodine and how that can impact tumors. And she tried iodine and it seemed to have arrested the growth of the fibroids. I don't know if you have any input on fibroid usage and reducing fibroids. And leading on from that, what have you seen in your practice with regards to low carb diets and helping with just overall women's health and fertility, if anything?
Yeah, so regarding the iodine, I've been hearing more and more people talk about that, and I'm really interested in kind of learning more about how that plays a role. So I'm not an expert in that. However, what seems to be kind of like a really helpful supplement these days with the information and the work that I'm doing is cod liver oil. Okay. And so cod liver oil is kind of like a magic bullet for a lot of my patients that have endometriosis and metabolic dysregulation. And that really has to do with, so cod liver oil is a nutritional supplement that comes from the liver of cod, the fish. And it has omega-3 and it has vitamin D and it has vitamin A, which is really important. And it's retinol palmitate. It's not the vitamin A that really comes from carrots. Okay. And so that being said, the liver is the biggest storage in an animal for vitamin A. Now, why is that a big deal? Well, our gut microbiome, our intestines are like the initial barrier from the outside world to the inside world. And so there's lots of immune cells and mucous membranes and barriers that will help prevent toxins and certain debris that shouldn't be in our body from entering. Now, there is something called the microbiome, which is a collection of healthy bacteria and yeast and protozoa that kind of work together in our intestines that act as like a first immune barrier to prevent us from getting sick from other toxins on the outside. Well, food for the microbiome is vitamin A. Okay. And it's actually something called a prebiotic. All right. Now, a lot of us, when we were younger, came from the generation that our parents would make us have a teaspoon of cod liver oil. Okay. Or they would put it in their orange juice and stuff. And every night you'd have cod liver oil. And that's because it's like kind of magic. It really does help prevent your immunity from going over wild, or from receiving a lot of inflammation in our body, because you don't have a very good, robust microbiome. Now, the microbiome is damaged by basically modern standard American diet. Okay. So, seed oils, vegetable oil, canola oil, those kinds of things, but also processed foods, and certain anti-nutrients. One of them is they're called nightshades or lectins. And so if people have these predispositions to this intolerance to even gluten, to lectins, then it can actually damage your microbiome and cause a lot of leakage of this inflammation down into our pelvis. And it can lead to what we're knowing now is endometriosis, which is really fascinating to me. Well, I have a lot of patients who, for a long time, I was treating with endometriosis with, after patients are like sick of birth control and surgery and stuff, they're just kind of willing to look into a lot of alternative stuff. And so I was using a lot of omega-3 fatty acid fish oil to help women. And that helps to a point because it's a really great immune modulator. It helps with immunity and vitamin D. But when I started reading more and more about vitamin A and cod liver oil, I was like, whoa, that's actually a prebiotic. That can heal your gut microbiome. And that can reduce that inflammation, that leaky gut that causes inflammation and collects in the pelvis. And that can lead to all kinds of problems like IBS and endometriosis and constipation issues and stuff. And so that's actually the prevailing theory of how endometriosis comes to be, is through leaky gut, which is fascinating. And so now I've kind of switched a lot of my practice into including cod liver oil. And a lot of women are noticing a ton of benefit with their gastrointestinal issues and the bloating and stuff. And so that's really exciting. So that's some of the stuff that I do. In terms of low carb, high fat dieting, well, the concept is really what I was sharing earlier, is reduction of insulin levels, reduction of inflammation. And there are these things called macronutrients. And so macronutrients are basically big nutrients that your body can use as fuel. Okay. So you need to have fat, you need to have protein, and carbohydrates are another thing that we can use as fuel, but it's not required. Okay. Because your body can actually make its own energy sources from fat and protein without any problems. So carbohydrates are like extra. Okay. There's something that we can use when we're under like a time of famine.
Mm-hmm. And that's contrary to what we've been told. We've been told,
right?
Reduce the fat.
That's right. Right. Because fat makes you fat. Right.
Right.
Well, that makes no sense for women, because fat, healthy fat, which comes from animal protein or olive oil or avocado and coconut oil, those kinds of things, fatty fish, is actually the building block for all our female hormones. So it's actually the building block for cholesterol. So if you don't eat cholesterol, you're automatically in crisis, because your liver can only make 30% of your daily caloric requirement for cholesterol. And that's it. And so if you don't eat fat, you're automatically in crisis. All right. And so your female hormones are never going to respond how they should, and you won't have normal functioning. And that's really incredible to me, and so that's why carbohydrates are really not necessary, because we can get the fuels that we need from fat and protein just fine. In fact, I remember sitting in biochemistry class when I was in medical school and learning that there's something called ATP, which is like our energy packets. And there's way more fat and way more energy from the ATPs in fat than there are in carbohydrates. And I was like, well, how come we just don't eat more fat? And someone was like, oh, diabetic ketoacidosis. And I was like, oh yeah, but that's actually not right thinking, because diabetic ketoacidosis is typically a concern for folks who are type 1 diabetic. And that has nothing to do with normal endocrinologic processing of someone who doesn't have type 1 diabetes, that's a problem with just insulin deficiency. Okay, the absence of insulin, not from diabetes and like type 2 diabetes as we know it and things. So that's not a thing. And so once I realized that and learned the chemistry of that, it was like, whoa, game changer. And so,
wow, yeah, completely. And
right. So
I never realized that the body only makes 30% of the cholesterol. Because you read all the time and see your body will produce all the cholesterol it needs from the liver. So you don't need to be consuming lots of animal fat, because that's the bad stuff. And so
yeah.
I've never heard that before, and that's very interesting. And I wanted to just go back to your cod liver oil point, because
Sure.
when I had fibroids before they were taken out and I had heavy bleeding, that was the only thing that reduced the bleeding.
Wow.
So I agree with you. It is powerful stuff. It's
Yeah,
amazing.
it's really great. And I think like there's so much here. And like there's here, the other thing is like I don't have all the answers, like these aren't all like magic bullets for everybody, but I think there's just so much that we have to learn, that we can learn about how women's bodies were meant to be. And it has a lot to do with this ancestral wisdom that really is not part of modern culture anymore. And so I'm really into evolution. I'm really into like medical anthropology and trying to figure out like what was the function of this, and like why were we made this way, and why do we think that we know better than or what our evolution is. And so a lot of the interventions and the work that I do really does stem from like looking back, like, to documents from like 100 years ago and things like that, to try to figure out like what were periods like really, like, or what did people do for painful periods back then, and that kind of stuff. And so going back into old textbooks and literature to figure out what was done then and how does that relate to how we are now in the future.
Yeah, I'm so glad that you're leading the charge with that. That's kind of where I have found my footing and my way forward, is looking back at what was done ancestrally. And there was a point I was following the Weston A. Price
Oh
Foundation.
yes, I'm
Yes.
actually reading the book. Yes.
So I have the book. I was doing the recipes. So when I'm now on a carnivore diet, and I wasn't always. I loved carbs. I loved carbs so much.
Yeah,
And
me too. Yes.
and so I used to be doing I learned about lectins and phytates, and I did realize a difference when I was soaking my oatmeal and when I'm not. It really affected my body. And going all the way and cutting out the carbs now, I have gotten rid of pains that I had, which is really amazing. And so I'm so curious as to how my health can change and how that could have affected my fertility, if I had been eating this way all along. And it's contrary to the evidence, or to what we've been told, that
Right.
you don't want a lot of protein or a lot of fat in your diet. You need to, have mostly carbs on your plate. So, that was a whole mind shift when I learned about the value of cholesterol, and you get it from animal fats more than plant fats, or plant oils. That was a
Yeah.
big game changer.
Oh yeah, I think that is like such a mindset shift, like mindset change. And the other thing is like there's also like the ethics also for some folks, because like I've had many patients like, and I work at Loma Linda University, like it's very plant-based and stuff. And so and really like I think the spirit of those recommendations came from health and not like trying to do bad stuff and like
I
trying to
agree.
eat processed foods. And that's super cool. Like I think that's a really good North Star to keep in. But there's also like a large amount of folks that's really struggle with the sacrifice of an animal, and
Yeah,
that's like a really big
that's
deal. And
understandable.
like yeah, and so then there's like ways to do kind of more low carb, high fat diet without involving animal protein, but you have to be really intentional about it. But I bring it up because like I have a large patient population that kind of has leanings towards vegetarianism and stuff for
Okay.
like varying reasons, whether it's faith-based or like ethics or whatever. And so I'm really sensitive to that, but if we bring it to the actual biology of insulin and inflammation, it's kind of hard to refute like the role of fat and protein and like limiting carbohydrates, and so I think like our ancestors did use beans and did use grains and stuff, but they processed it in a way that honored like the nutrients and the anti-nutrients like within it. And I don't know, I'm a Mexican American woman. Like I always tell people like, yes, tortillas are things that like my ancestors made, but have you ever tried to make a tortilla? Like, I'm like,
it's
if you
time
can
invasive
tortillas, like go ahead, like you deserve it, because I've tried, I'm terrible. Like I don't have problems with sticking dough and whatever, but like, you're not going to have like 10 tortillas because number one, you made it. It took forever. You want to see, and that's just not how like we do it anymore, right? You go to Costco, you get like your 100 pack, and you're good. But like, so I'm not trying to say that like what we ate as our ancestors ate wasn't like doesn't apply, because it definitely does. We just live in this modern agriculturalization, and like we've lost the way our ancestors used to process food. And so if we have the time to do it, like go for it, like that, I think that's cool. It's just not how we do it anymore, which is why cod liver oil makes a lot of sense, because not very many of us are eating liver 3 times a week,
right.
So, but the French are awesome. Like the French have it down because they eat pate.
And it's so good.
Right. It's so delicious, and it's liver. And so, I'll do pate. That sounds awesome. So then I'll just skip my cod liver oil that week because like I have a couple of servings of pate. So I think that, I don't know. I don't have all the answers, but I definitely really want to help folks that understand the physiology, and then they get to decide.
You bring up a very important point, because there are real concerns that people have. And so what would be your advice to persons who want to go the plant-based route? How would, how should they go about making sure that they have adequate fat or adequate protein and still have that low carb introduction into their diet?
Yeah. So, there are all kinds of like different macronutrient ratios, and I know there's a lot of people that like are really numbers based, and they like to look at what the numbers and the ratios are and stuff. But by and large, like 70% of your macronutrients per meal should be fat, and then 20% should be protein, and then the rest is carbohydrates. And so there are lots of really cool websites that can teach you these ratios. One of them is something called dietdoctor.com that has like a lot of really cool ratios of the macronutrients, and they have excellent vegetarian recipes and stuff. But if you have enough fat, healthy fat, then you're good, because fat is very satiating. And so if folks can do that, then really they're golden. The only thing that they just need to supplement is like the animal-based vitamin A, as well as the B vitamins, and which are usually found in animal proteins. And so that being said, there's a lot of different ways that people could do that. The other thing that's very helpful for folks who are very data driven is a continuous glucose monitor. And so if you can slap on a CGM, and then you notice like, oh man, like every time I have lentils or beans, like my numbers go way up, then that is like, okay, well, there you go, and unfortunately, it's actually not physically possible per day to take in enough legumes in order to meet your protein requirements that are needed on a daily basis. And so that part is kind of hard to swallow too. So that's why like fat is really important. And addition of any kind of, protein that is not just legume based is going to be very helpful for folks that tend to lean that way.
All right. That was wonderful. Do you have any recommendations for persons who are on the journey of infertility, and how they can improve their lifestyle or their diet to, improve their fertility? I don't know, maybe raise their AMH, or just what they can do to improve the egg quality. So whether or not they have to use assisted reproduction, that they can just have their best shot at that.
Yeah. So let's talk about what normal fecundity is. So fecundity is like a woman's ability to conceive. Okay. So before age 35, it should take, by and large, about a year to have a successful conception, okay? Which the ability to actually conceive per month during that year is about 15% or so. So it's not as quick as like you would think. And so before age 35, about 12 months of active trying, having sex around your ovulation time. And don't work too hard. Don't have to get ovulation predictor kits if you're having regular periods and stuff. Just have sex, enjoy, and because if it becomes too rubric-y, like it's not that fun anymore, And so that being said, 12 months, for 1 year before age 35. After age 35, we say, okay, about 6 months, and when you hit age 40, about 3 months, because by then you need to be starting to, after you hit those marks, you should be including like some sort of gynecologist in the journey of trying to figure out what's going on. And 50% of the time it's female factor, but 50% of the time it's male factor. Okay. And so we can't forget that we're not the only ones carrying the burden of fertility. But let's say all that, you go and see your gynecologist and then they're like, you tell them like, hey, I'm having trouble, getting pregnant. My husband has normal semen analysis. Then, okay, what now? Well, there's a lot of things that should be done. One is to kind of look at, and let's say you've never had a baby before, so get an ultrasound. Another really great imaging modality is something called a hysterosalpingogram, where you can actually inject dye into the uterus and see how it flows out through your fallopian tubes and make sure those are open. And then a lot of blood work. And so some of the blood work that can be done are actually not the blood work that you would normally think about, So one of them is something called the insulin level, because remember, a fasting insulin level, if remember how I alluded to earlier, is if your insulin level is really high, it'll block ovulation. And so you really want to shoot for an insulin level that's below 10, and it should be done fasting. And so, but the thing is that there are these slender people who tend to have low insulin levels kind of always, and their insulin level, it never really gets high enough to sequester a lot of the glucose that they might be eating all day long. And so, so the insulin level, it's really helpful, but you kind of have to know what kind of body type you are, because there are some people that their insulin levels low in fasting, but then when they eat a high carbohydrate meal, it's really high for a long time. And then we don't catch that level because we just catch it fasting. But a lot of times people know about this about themselves because they feel hangry. Like within a couple hours of eating, they're like starving and like get really hungry. Well, that's because their insulin level shot up so high and it brought it down so low that that's where all of a sudden the trigger of feeling hungry comes from. So insulin level is really important. A lipid panel is really important, including triglycerides, because triglycerides are reveal to us how our body's processing fructose, and fructose and some of like the fatty acids that we eat. High triglycerides in modern diet really has to do with high fructose corn syrup, alcohol use, or just fruit in general, because insulin doesn't control fructose. Okay, so that's really important to understand. The other metabolite in the lipid panel is HDL, and HDL is our good cholesterol. And so that has to do with eating, healthy animal fats and exercise as well. And so also avocados and olive oil have HDL rise too. And those are the big ones. Total cholesterol is not completely helpful, and LDL not necessarily helpful, like in like the fertility game and stuff. But those are really the other two metabolites are helpful. There's like LH and FSH that can help us, and there's these ratios that kind of look at whether someone has more of a tendency for PCOS and stuff. And then there's also something called prolactin, which is another hormone that comes from your brain that helps with breast milk production, but sometimes it can be high if there's like a small tiny tumor in the brain that can stop your ovulation, or even PCOS can cause rises in insulin or prolactin levels as well. There's AMH levels, and AMH is something interesting. It's not necessarily helpful to check because there's no great data to give us information about what it means in someone who's not struggling with infertility. But when someone is struggling with infertility, it helps us understand ovarian reserve. And so when it's below 1, it's very indicative of like vascular inflammation and difficulties with ovulation and ovarian reserve. If it's above like 3 or 4, then it's more of like the polycystic ovarian syndrome tendency, because the ovaries are trying to secrete and trying to ovulate. And so they're secreting this anti-Mullerian hormone that shows that it's trying to do its job, but it can't ovulate. And so that's why it's elevated in that population. And so those are kind of the big ones. And hemoglobin A1C is helpful just to diagnose if you're diabetic or not. But if it's normal, it doesn't mean that you're not pre-diabetic. That's where an insulin level comes from, and a triglyceride level. Thyroid hormone is also helpful. Most of the time that's normal. But yeah, so those are kind of the big ones. Also STD screening, like you'd be surprised. There's a lot of folks that have undiagnosed like STDs and stuff that are problematic for infertility as well. So those are kind of like the big things that I would ask for in the evaluation. But insulin level is a really big one.
On the insulin levels, I was reading recently where the body does need some insulin to help with ovulation. And can you tell me some more about that? And if we're on a low carb diet and your insulin need is low, does that affect your fertility at all?
This is good. Okay, so these are really great questions, because we have to remember that we as women need a little bit of carbohydrates so that our brain doesn't think that we're in nutritional crisis. Okay, and so there's something called hypo, which is hypogonadotropic hypogonadism, which is a fancy term for your brain feeling like it's under a stressor because there's not enough nutritional requirement going on. So it shuts off your ovulation. We see it in athletes. We see it in, like the gymnasts and like women who have anorexia, because their nutritional requirement is so low. They don't eat anything, that their insulin level is really low, but falsely low because they're just not eating. And so because of that, then they don't have the nutritional requirements to support a pregnancy. Okay. And so that's why that's that tip on that piece is so when we relate it to carnivore dieting, it's actually really important. I actually have Mindy's book here. It's called Fast Like a Girl. And it's important to kind of have more of a female-based approach to carnivore dieting, because in that is also like a lot of fasting, because when people are carnivore, like they're just full and they feel great and they aren't hungry anymore. And so what happens is, like, the week before your period, which is the week right after ovulation, your body needs a little bit of carbs so that it can feel that it has enough nutritional requirement to support a pregnancy. Okay. And so that's where the cravings for carbs come in, like the week before your period. You're like, I really want to eat, but we kind of tend to overdo it, but you really want a lot of carbs during that time, and not a lot. Like I'm talking like 30 grams per meal, at the most, because that will help support a robust ovulation and allow for a really good implantation. And so if your body thinks that you're kind of starving during that week, then it really doesn't allow for good pregnancy. So I know there's a lot of people that feel really passionate about being carnivore. I think it's really great. And Ada Fox, who's called the Black Carnivore, is actually one of my friends she's a really cool YouTuber, and she's awesome. We once presented at a conference together, and I think it's really great. I just think we have to figure out what our goals are, And so if during fertility, I usually just tell people to have a little bit more carbs, like during that week before your period, because sometimes people are so good at this. And this is actually what used to happen to me, is that if we have such little carbs, then your ovulation isn't robust during that time. And you tend to have a little bit more breakthrough bleeding before your period starts. And so you'll get like this brown discharge for a few days before your period. And that just means that your ovulation wasn't as great. So it's the addition of a little bit of carbs during that week before your period helps a ton. So.
Well, that's very helpful. So
yeah.
And I think I've been on carnivore for about a year and a half almost. And I eat throughout the day, because if I don't, I undereat. So I have to
be very intentional.
I have to be very intentional and eat my 3 meals, or else I feel full and then I'm not getting enough calories. And so I found that I started to have cravings as well, as I've moved along in my journey. And I'm feeling like maybe I need to have a little more carbs in my diet occasionally, or,
Yes.
just a little bit ongoing. So, but then you mentioned not fructose. So what kind of carbs?
Yeah, so that's fructose would be okay, but I mentioned not
Okay.
fructose in the setting of insulin doesn't process fructose. Okay.
Okay.
And so your liver is the only place that processes fructose, so it's not managed at all by insulin.
Got
Insulin
you.
only manages glucose, and so, but yeah, a little bit of fructose is just fine, or any kind of like grains or whatever is okay too, because the grains are more glucose mediated, and so when they get broken down, so there's like these things called monosaccharides, which are like when you break down sugars to their final molecule, you've got glucose and fructose, and so glucose is insulin, fructose is liver. And so, and unfortunately, in modern culture, non-alcoholic fatty liver disease is the leading cause of liver transplant right now, which is really sad. And it used to be from alcoholism, but now it's just from processed food, it's terrible. High fructose corn syrup is really bad.
So one question, I know we're almost at time. You mentioned AMH, and it can be low, it can be high, but does our AMH really tell the full picture of our egg quality? And what, does it tell that picture of egg quality?
Yeah, it just kind of depends on when you had it drawn. Like a lot of these hormones are not like an average, like they're kind of like a snapshot of where someone is in their metabolic journey. And so that being said, it's really hard to put all your eggs in one basket of like, oh man, I have a low AMH, like forget it. Like, and if a woman is like 45 and has a low AMH, well, that totally makes sense, but if they're in their 30s or something, or before age 45, like there is some, non perimenopausal reasons for a woman to have low AMH at that setting. And so it usually has to do with vascular health. And so I still think that even if someone has a low AMH, there's a lot of room for improvement in terms of reducing those vascular inflammatory responses that lead to poor egg quality, And so, I just take it as one extra piece of information that, and really like, other than the diagnosis of diabetes, like there really isn't like so many blood, like a blood analyte that is like it's either yes or no or black or white, like there's so much give in all this, and that's where I think personalized medicine and really like it, trying to figure out who it is that's in front of the doctor, to really help tell the story of what kind of health that they're in. So.
Well, thank you so much, Dr. Salcedo. If persons want to reach out to you, how can they do that? And tell us where you are and how to contact you.
Yes, thanks, Casey. So I have a YouTube channel. Doesn't everybody know, right? And so it's Conscious Gynecologist is my YouTube channel, and it's kind of the same handle for my Instagram feed. I also have a website called ConsciousGynecology.com where people can schedule like a telehealth visit. I work at Loma Linda University Health. If anyone wants to see me in person in California, happy to see it. But yeah, reach out to me in any of those modalities. I'm happy to help with any little, question. Obviously I can't give medical advice like in like these like social media, like modalities and stuff, but I can help steer people to the things that they need. So.
And I'll leave all your information down below.
Thank you.
Thanks so much. And I had so many questions that we haven't gotten to, so I'm going to invite you back on later on in the year.
Oh,
Thank
yeah,
you
that
so
would be
much.
Yeah,
that'd be awesome. Yes, wonderful. Thank you so much for your time, and we'll be in touch.
Thank you.